Hello, my name is Peter and I suffer from migraines. And I never knew it. I never knew it until recently. My history, the symptoms started about 12 years ago when I was in hospital with another completely different condition. I would experience the symptoms of migraine and when trying to explain to the doctors in the hospital and subsequently when I left hospital and as I got better over the years with this other condition, because I was unable to use the correct terminology, the correct words, no one was ever able to tell me what it was that I was suffering from. My symptoms are quite specific and they've stayed the same throughout the 12 years. The first symptom that I get is a little bing that seems to go off in my eye, for want of a better place. It's possibly somewhere beyond the eye. Bing! And I get blind spots. Again, not associated with one eye or the other. Closing my eyes doesn't make any difference. Having one eye open makes no difference whatsoever. I have these blind spots. That would last me for about 5 minutes. Eventually, the blind spot turns, it moves to the side, to the right of my eye, and forms like a zigzag pattern around my eye, in a semicircle around my eye. I feel nauseous, I feel dizzy, I feel really that I can't focus properly on things around me. To actually focus on something, I need to look away from it, which seems ridiculous, isn't it? And of course I wouldn't focus properly that way, but that is the way I would cope with it. So that zigzagging would crescendo, would grow, and then there'd be a warmth. I feel warmth behind my eyes, somewhere within my brain possibly, and it reaches that climax and then dies away. What I do to cope with it when the attack happens is, if at all possible, I would lie down. I would lie down and try and sleep. Sometimes it's not possible to do that. I'm out driving or whatever, or I'm shopping, or I'm outside of the house. I'm not available for going to bed or lying on the bed. In which case, it's a case of just basically sitting down and waiting for it to pass. The maximum length is 20 minutes, 25 minutes possibly. Sometimes I fall asleep when I am lying down, and when I wake up it has passed. Well, I don't know what causes it. I suspect what brings it on, which is slightly different to the cause. What brings it on to me seems to be a sense of frustration. It's not stress, because I do stressful things, which I enjoy. I enjoy being stressed on occasions and doing new things. But quite often a sense of frustration, maybe over silly little things. I feel totally frustrated, and instead of coping with it, something goes ping, and that is the offset. I don't know if that's coincidence. I don't know if that is what brings it on, but that's the only handle I can stick on it. The only label I can say is frustration. For me, seems to bring it on. It was only actually 2 days ago when I decided to Google my symptoms, and I hit upon the correct formula or the correct words to use to sort of bring out the whole explanation of what I was suffering from. I was stunned to think that it was migraine, because I've always associated migraine with severe headaches, and I've been very fortunate, obviously, that some people have what I suffer from, and then subsequently it develops into a huge headache that knocks them out for a day, 2 days, 3 days even. So I'm extremely fortunate that my symptoms, my aura, my migraine aura or migraine aura, does not subsequently go into the headache and the vomiting and the nausea. Obviously I'm just touched by this illness, and I'm very fortunate. But yes, just 2 days ago I described my symptoms. I put the words vision zigzag into Google, and I was stunned to see that millions of others are suffering just like myself with it. Many people are suffering horrendously with it, but I'm so pleased that I found out what it is, because I thought, well, I've got something wrong with my brain. I've got a brain tumour, or I'm going blind, or there's something wrong with my eyes. I managed to discount the latter one, because closing my eyes doesn't make any difference whatsoever to how I deal with the illness. Also, I was really was pleased about that, but also to get a diagnosis, to know exactly what I've got, and therefore I feel I can cope with it a lot better, and I can go into groups and find out little tips and hints on how people help get rid of it when an attack does come. And there is one, I must say, that it does fit in really with my lifestyle, and that is when people have an attack, they should rehydrate, drink these power fluids to rehydrate their bodies, and that's something that maybe I've missed. That sort of aspect of my looking after myself, I have fallen down with. So therefore that is for example, that is one huge tip that I've received from having the correct diagnosis. So thanks to Google, thanks to everyone who's ever put anything up about these migraines, these migraine aura, and all the words associated that we should use when we go to the doctor. Fortification, it's called, and the zigzag around the eyes. They will possibly know what I'm talking about next time I go, but they didn't have a clue. They thought it was some stress or whatever. Didn't quite understand what I was getting at, but they do now.